Okay, so welcome to today's session in pharmacology. And in today's session, we'll start looking at antihypertensive drugs. So this is also one of the major groups of drugs that you need to understand, because hypertension as a cardiovascular system condition is one of a major concern, because a lot of individuals are having to carry the burden of having to live with a raised blood pressure constantly for the rest of their lives. And hypertension has a negative effect on the heart. You find that in the long run, the heart muscles may enlarge, and then once the heart muscles enlarges, this may cause weakness in the heart muscles itself, resulting in a stroke, heart failure. And remember, heart failure may also lead to a stroke. So controlling the blood pressure is very cardinal. Therefore, the importance of you understanding antihypertensive drugs and which drugs can be used whenever a patient has a raised blood pressure. So we can go straight and look at what hypertension is all about. When we say hypertension, it means raised blood pressure, and in simple terms, hypertension, it is raised blood pressure against the walls of the blood vessels. Remember, BP or blood pressure itself, it is just the pressure against the walls of the blood vessels. But in hypertension, this blood pressure is raised going beyond the normal. Therefore, that's why we have antihypertensive agents which act or which are used to reduce the blood pressure. And apart from that, you find that when you are checking the blood pressure, there are two parameters that you focus on. There is something which is termed as the systolic blood pressure as well as the diastolic blood pressure. When it comes to the systolic blood pressure, this is the first bit that you are going to get when you're checking for the blood pressure. Remember, when you use a sphygmomanometer, the one which you put on the upper arm, preferably left arm, so as you start inflating it or pushing air in it, it ends up blocking the blood vessels, the brachial artery, which is on the left upper arm rather. So once that particular brachial artery is blocked, then you open up the valve and you start releasing air. Now, as you release air, you are going to have a stethoscope and you'll be listening to the heartbeats. So the first beat that you're going to hear in your stethoscope, you record that figure as you check on the readings on the sphig, and you record that figure as your systolic blood pressure. Then the last beat that you're going to get in the stethoscope, you record that as the diastolic. But of course, right now we have automatic sphygmomanometers where you just press and click on a button and it does everything for you to give you the systolic, which is the figure on top, and the diastolic, which is the figure down there. So when it comes to hypertension, both the systolic and the diastolic may be elevated, and sometimes only the systolic may be elevated or only the diastolic may be elevated. So you find that systolic or diastolic or both may be elevated, and still this will be termed as hypertension. Now, when it comes to hypertension, we have what is termed as essential or primary hypertension as well as secondary hypertension. So when it comes to these two types of hypertension, when we talk of essential hypertension, this one affects majority of the individuals, and mostly primary hypertension or essential hypertension has no specific cause, but this mainly may be related with genetics, a family in which you are born from, amongst other predispositions. Then in terms of secondary hypertension, this mainly accounts for about 5% hypertensive patients and results from things such as underlying disorders as aortic regurgitation, renal artery stenosis, pheochromocytoma, and neurological diseases. So when it comes to secondary hypertension, in secondary hypertension, there's another disease in the body that is resulting into this individual suffering from this particular hypertension. But when it comes to primary hypertension, it has no specific cause, but there are a lot of predisposing factors that can predispose someone to primary or essential hypertension. But in secondary, take note that there is an underlying disease, and we have given examples such as aortic regurgitation, renal artery stenosis, pheochromocytoma, as well as neurologic diseases. These are diseases which we'll discuss furthermore in medicine. But you just know that in secondary hypertension, there is an underlying disease or condition causing a rise in blood pressure. So you'll find that treatment of secondary hypertension mainly will depend on treating the underlying cause or the underlying disease. Now, when it comes to uncontrollable hypertension, this can lead to a hypertensive crisis as well as malignant hypertension, which is mainly characterized by a diastolic blood pressure of above 140 millimeters of mercury. So if someone is not controlling their hypertension, you find that in the long run, this rise in blood pressure will become severe or worse, whereby this individual, if they don't take antihypertensive drugs, immediately the blood pressure shoots or goes beyond normal. Or whenever they go into a hypertensive crisis, you find that it may even cause this individual to collapse. They become unconscious, and other problems may come in because they are now having what is termed as a hypertensive crisis due to uncontrolled continuous experience of hypertension. Then when it comes to hypertension, you need to have some aims as you give treatment to individuals. And some of the aims that we can have as we are treating someone with hypertension is that the first aim is, of course, to maintain normal blood pressure. When you want to reduce the blood pressure of someone, the first aim always is to something in the back of your mind is to ensure that the blood pressure is reduced to the normal levels. Apart from that, the other aim should be to prevent complications that may arise due to someone having hypertension. For example, we gave complications that may come in, such as CCF, which is congestive cardiac failure. Apart from that, also CVA, cerebrovascular accident. These are conditions which we are going to discuss more in medicine, and you will have a proper understanding of what these conditions come about and how they are, or what it is about them. Apart from that, the other aim is, of course, to prevent death. Even though people may not think it as one of the major aim, but hypertension can easily cause someone to die. That's why it is known as a silent killer. Someone may just be complaining of a headache, and then a few minutes later they collapse and they are gone, because a rise in blood pressure can also cause aneurysms to occur. Maybe the aorta itself, which is the largest artery, bursts, and then blood can't be delivered to the body tissue. You end up losing that individual's life, or even just blood vessels rupturing from the brain. So hypertension is known as a silent killer, and that's why we are saying one of the aim is to prevent death. Okay, we can move on. When it comes to hypertension, we are going to look at it in two ways. The first way, we are going to talk about some non-pharmacological therapy, then we'll move on to pharmacological therapy. So in terms of non-pharmacological therapy, we are talking about interventions that you can do which do not require use of drugs. And some of the interventions that you can do which do not require use of drugs, some of them is lifestyle changes. So in terms of lifestyle changes, you can talk about cessation of smoking. Smoking is one of the major predisposing factors to hypertension, because in cigarettes there are chemicals such as nicotine and tar, and these two, they can cause vasoconstriction of blood vessels. Apart from vasoconstriction, they also attract cholesterol, which is fats, inside the lumen of the blood vessels, and this can end up rising the blood pressure. Apart from that, moderation or stopping alcohol intake. So you find that alcohol also increases the blood pressure because it causes retention of sodium, or there's too much sodium which is retained when someone is taking alcohol. As a result, this may cause a rise in blood pressure. Apart from that, weight reduction. Remember, when someone is gaining weight, it means that there's a lot of fats which are being stored under the body tissue, and these fats may also end up accumulating in the blood vessels, reducing the lumen of the blood vessels and then raising the blood pressure. Apart from that, making yourself happy all the times, avoiding stress. When you are stressed, certain chemicals are released certain chemicals are released, amongst them serotonin and other chemicals, which increases absorption of fats in the blood vessels as these chemicals are circulating in the body. But when you are happy, these chemicals are not released, meaning having stress is one of the predisposing factors to hypertension. Therefore, to prevent you from experiencing hypertension, make yourself happy, avoid stress. Apart from that, the other non-pharmacological therapy that we can use as we manage hypertension is exercises. So regular exercises or physical activities are encouraged, but not vigorous ones whereby you end up putting pressure on the body. So regular exercises, you find that they will help burn or break down fat accumulation in the body, and this can be good in prevention of hypertension. Apart from that, in terms of diet, we can make adjustments in terms of the diet of an individual by avoiding and as well as reducing on salt intake. So salt intake is sodium. Where sodium is, water also follows. So the more you take in salt, the more water is retained in the body, and then this will increase the blood pressure. Let's give an example where you are eating popcorns. Popcorns, because of salt that is added to give that taste to the popcorns, you find that as you eat popcorns, it also forces you to drink in a lot of water. And that is a good example of knowing why or why we drink a lot of water when we are eating popcorns. It's because of too much, or it's because of presence of salt that we add to popcorn so that it just has that taste. Then apart from that, in terms of diet, we can also avoid eating a lot of oily foods or fatty foods, because increasing fats in the body, this may close up the lumen of blood vessels, increasing the blood pressure. So now we can move on to pharmacological treatment of hypertension. And in terms of the pharmacological treatment, we'll look at drugs such as the sympatholytic agents. Apart from that, we'll also talk about vasodilating agents. We'll talk about angiotensin converting enzyme inhibitors and some diuretics. So once we look at these, then we would have talked about drugs that can be used to prevent or reduce blood pressure. So we'll go in details and talk about these particular drugs. So the first group of antihypertensive drugs that we are going to talk about is the sympatholytic agents. So when it comes to the sympatholytic agents, how they work is that they inhibit or block motor and as well as sensory action in the sympathetic nervous system. Now, when you look at the sympathetic nervous system, this is a system that provides a control in the body without us knowing. So, for example, there are certain things that we can control in our body when we decide to control them. Let's take, for example, you feel the urge to urinate right now. You are going to decide whether to urinate where you are, whether it is convenient, or not to urinate because it's not convenient. So you are going to hold the urine, meaning you are controlling the nerve innervation willfully. But when it comes to the sympathetic nervous system, this system controls things in the body which we don't control by will or by our brain, just by us focusing on something and then we control it like that. And one good example is our heartbeat. You cannot control to say today I don't want my heart to beat, or I want it to rest now for about 15 minutes. You have no control of heartbeat. But what controls this is because of the sympathetic nervous system. That's why up to now I've never heard someone who has committed suicide by just stopping to breathe. The reason is because, again, we don't control the contraction and relaxation of our lungs. This is purely controlled by the sympathetic nervous system of the brain. So now, when we talk about sympatholytic agents, these drugs are controlling the sympathetic nervous system by blocking the motor and secretory action in this system, those that control the heart, either to relax the muscle or to make the heart pump more. But mainly you find that these, they help in relaxation of muscles that control heart contractions as well as heartbeats. So apart from that, you find that they are also classified according to their site of action as well as mechanism of action. So sympathetic agents, again, they are further grouped into their smaller mode of actions based on the type of nerve they are affecting once you take that particular drug. So when it comes to the sympathetic or sympatholytic agents, we'll look at the first group, which are the central acting sympathetic nervous system inhibitors. So these, they act on the central nervous system. So the central acting sympathetic nervous system inhibitors. So meaning these, they act through the nerves that are found in the brain or in the spinal cord. And examples of these drugs that act in the central acting sympathetic nervous system inhibitors, and we have drugs such as methyldopa, clonidine, we have guanabenzine acetate, as well as guanafancin. And when we talk about this group, you find that methyldopa is one of the commonest drugs that is used under this group. So in pharmacology, we'll be looking at examples of drugs being used as the ones which are common, but even the others can be used, and this depends on the country where you're working from. But in the Zambian setup, you'll find that methyldopa is one of the commonest drug bought, but even others can still be found in pharmacies. So when it comes to methyldopa as a common drug under this group, this is what we can talk about. The dosage, when it comes to the presentation rather for methyldopa, it comes as a tablet of either 250 milligrams or a tablet of 500 milligram, and that is its presentation. When it comes to the mode of action, the mode of action of methyldopa is that it acts by inhibiting stimulation of the sympathetic nervous system. So it inhibits stimulation of the sympathetic nervous system. Remember, sympathetic nerves, they deliver information to the heart by making the heart contract and relax, or pump blood faster or pump blood slower. So when we talk about inhibiting, meaning it reduces the ability of these nerves by making them not to make the heart pump blood faster. So it makes the heart to start pumping blood low, because the nerves that supply the information to the heart have been inhibited, or they are being prevented from delivering a lot of impulses to the heart. And in doing so, you find that the blood pressure can drop. When it comes to the indication or use, you can use methyldopa for management of hypertension in pregnancy. But apart from that, you can even just use it in management of hypertension in general, even not in pregnancy. But in pregnancy is one of the good choices, because it does not disturb other factors or other things while a woman is pregnant. And when it comes to the dose of methyldopa, you can give 250 to 500 milligrams 2 times or 3 times a day, and this can still be increased gradually, but you shouldn't exceed a maximum of 3 grams in a single day if you're prescribing this particular drug, meaning you shouldn't give it 4 times a day, but the maximum you can go is 3 times in a day. Some side effects of methyldopa One of it is postural hypertension. So postural hypertension, you find that sometimes the patient may take this drug and then they lie flat on the bed. And then immediately they stand, especially where you stand abruptly, someone collapses or experiences a headache that comes abruptly, which is one of a symptom of hypertension. So you find that postural hypertension is where someone experiences a rise in blood pressure based on the posture that they are adopting at that particular moment. So someone may be lying flat after taking the drug, but immediately they stand and then the blood pressure rises. So that is going to be termed as postural hypertension. Apart from that, dry mouth, GI disturbance, so gastrointestinal tract disturbance, such as nausea and vomiting, diarrhea, abdominal pain, all those are some of the side effects that can be experienced. Stomatitis, so you find that the lining of the mouth may be inflamed, hence the patient may experience this because of taking this particular drug. Bradycardia, where the blood pressure drops below normal, this may also be experienced because the patient is taking this particular drug. Impotence, so in men they may have difficulties having children because of being on this particular drug. Then apart from that, exacerbation of angina. Now angina, you find that it may cause clot formation, so blood clot formation, and this, when this blood clot forms, they may end up blocking blood vessels, which may cause pain. And if this blocks, let's say the heart muscles, someone may be experiencing chest pains, but this can also cause heart failure because blood vessels are not supplying blood to intended body tissues, which may cause tissue death or ischemia. Hypoxia, which can lead to tissue death. Then apart from that, also Parkinsonism. So you find that this drug can result in Parkinsonism because it can damage the nerves. And in Parkinsonism, you find that one of the major symptoms is shaking. Someone will be shaking like they are shivering throughout, and this is uncontrollably. And Parkinsonism comes in because there's degeneration of the nerves. The nerves are being damaged from the drug, and this is a permanent side effect. You cannot reverse it. So you find that someone can experience Parkinsonism while they are taking this particular drug. Apart from that, we have another group of drug which are the beta adrenergic blocking agents. In short, they are known as beta blockers. And amongst the beta blockers, we have drugs such as propranolol, atenolol, acebutolol, metoprolol. Apart from that, we have pindolol, nadolol, as well as timolol. So amongst all these laws, we are going to look at one of the common drug, which is propranolol. So when it comes to propranolol, its presentation is 40 milligrams. So meaning the full tablet comes as a 40 milligrams tablet. And the indication or use, propranolol is used in management of hypertension. The dose of propranolol, you can give 20 to 80 milligrams twice a day, but it can be increased gradually. But the dose you can give 20 to 80 milligrams. In children, you can give 1 to 4 milligrams per kg body weight, and you can give it twice per day. Side effects of propranolol, you find that some of its side effects are bradycardia, hypotension, depression. Someone may become depressed, bronchospasms, so someone may be feeling like the heart is racing because of being on this drug. Apart from that, thrombocytopenia, so there may be a reduction in production of blood cells, and this may cause other problems, especially where white blood cells are not being produced, the thrombocytes themselves. Then apart from that, dry eyes, insomnia, someone can develop challenges in falling asleep. Apart from that, hallucinations, someone may also start hallucinating because of being on this particular drug. So those are some of the side effects that may be experienced on this particular drug. And remember, we have always talked about nursing implications. Nursing implications can come from side effects, and in terms of this particular one, you can say I will monitor the patient for symptoms of depression or hypertension by checking frequently the blood pressure. So that is something that you can do as a nurse. You can monitor that. So nursing implication, you shouldn't have difficulties coming up with them, because you can come up with those from the side effects. Just pick one side effect that you can talk about, and you'll find that it's correct. Apart from that, the other group of antihypertensive drugs that we can talk about is alpha adrenergic blocking agents, or the alpha blockers. And here we have drugs such as doxazosin, phentolamine, we have prazosin, we have terazosin. And here we can probably look at a common drug which is used, which is prazosin hydrochloride. And prazosin is also used in management of hypertension. The dose in adults, you can give 0.5 to 1 milligram per oral, and you can give it twice a day or 3 times a day as maintenance dose. And it can also be increased to a range of 6 to 15 milligrams in a single day, depending on the severity of the condition. But of course, it is given in divided doses, whether 2 times or 3 times or 4 times a day. Side effects of prazosin, or you can experience orthostatic hypotension. Apart from that, first dose syncope. So high orthostatic hypotension, you find that the blood pressure drops immediately someone maybe stands or does something, or do a bit of work. Then apart from that, when we talk of first dose syncope, someone may collapse after taking the drug immediately, and that is what is termed as a syncope, first dose syncope, someone collapsing because of the drug. Then apart from that, angina attack, so someone may develop angina pectoris, chest pains because of maybe a disturbance in blood supply or formation of blood clots which are blocking circulation of blood in the heart. Heart palpitations can be felt. The heart, you feel like the heart is racing, like you're from running a race, meanwhile you're just seated. So someone may start experiencing heart palpitations. Rebound tachycardia, again the heart may race because of increase in heart muscle contractility, and this is what is termed as a tachycardia, and this may happen because of someone taking prazosin. Then apart from that, some of the general nursing application that we can talk about from these groups of drugs that we have talked about are such as you need to obtain the baseline data before beginning the sympatholytic therapy, and apart from that, assess the patient's blood pressure and pulse in the sitting as well as standing and supine position. Apart from that, you need to monitor and record the patient's blood pressure and pulse when starting therapy before administering each dose, as well as during peak concentration times. Other nursing application that we can talk about is that you can monitor the patient's vital signs as instructed. For example, you can expect to monitor the patient's blood pressure and pulse every 15 or 30 minutes for at least the first 2 hours during the initial administration. Apart from that, you can also monitor the serum electrolyte levels and correct any imbalances as prescribed before administering a norepinephrine depleter. So norepinephrine, in other words, it's adrenaline, which can be used in resuscitative purposes if at all the patient goes to the waste as they are taking this particular drug. So these are some of the nursing applications that you can have or you can do as the patient is taking the drugs that we are from talking about. So for today's session, this is where we are going to end. We'll continue and finish up the other sessions, and next time we'll continue on the vasodilating agents. So be sure to look out for next session's lesson as we talk about the vasodilating agents. Enjoy your day or your evening.